Good evening. My name is Casa, and I am the Client Services Manager for End of Life Washington. Thank you so much for being here. It's exciting to see you all on this call. I'm going to reckon a guess that if you're sitting in the audience tonight, you likely believe medical aid in dying should be an option. Maybe you have past experiences with medical aid in dying, and maybe you have considered it for yourself when the time comes. Many people, myself included, go into their end of life confident they will have access to this law, and the truth is many don't. 1 in 4 people don't make it through the waiting period. These are people who have voted for this law, who knew how to ask for it the moment they became eligible and understood how the law worked, and still they were met with such barriers that they ran out of time to have this as an option. Also, in this state, we have seen unprecedented growth of folks seeking access to the law, and we're falling behind. Without action, we won't have enough providers to support the number of people making requests in the state, and it's putting enormous pressure on End of Life Washington as an organization, and we're scrambling to meet the requests that we do have. I hope that you can hear the sense of urgency in my voice, and what I can tell you is we have to do better. The Death with Dignity Act passed in 2008, and it needs to be updated to 2023. Into the 21st century and into modern medical practices. Without this bill, we prevent eligible terminal adults from having this option. I've been in my role for almost nearly 3 years now, and after 3 years, I'm sitting before you both tired and excited. I think we're all a bit tired, the clients, the loved ones, the volunteers, pharmacists, providers, social workers. We're tired of the phone calls explaining to people that yes, this is a legal choice, but no, it can't happen faster than 15 days. We're tired by holding the space for the loved ones who watched their people suffer because the process to access this law was too long, too onerous, or too inaccessible. We're made tired by the nurse practitioners and physician assistants who are desperate to support their own patients, but cannot. Tired by the inequities in the law across the state, and for the folks who can't access this because of where they get care. Tired by the long drives made by volunteers, pharmacists, family members to pick up prescriptions because the closest pharmacy is hours away. We have to do better. And while I'm tired, I'm also really excited and hopeful. This, in my personal opinion, is the best bill that we have put forth, and it has the best legislative support, and it has you all, the community full of people ready to rally it into passing this year. So we're going to go over some of the main components of the law, and all of which of these components are aligned with the national strategy and directions of medical aid in dying laws in our nation and where we are headed. You'll recognize some of these components from the previous year's laws, and there are some new changes as well. So the first is that this law would allow physician assistants and advanced registered nurse practitioners to be one of the 2 required providers. This is a crucial part of this legislation. We cannot sustain the growth we are seeing in the state without more providers. We have a restricted healthcare state, and we need more qualified medical providers to make this option available to their patients. We are also doing a shortened waiting period with this law. The waiting period would go from 15 days down to 7. And while that still is a waiting period, the most important part that I'm excited about is that this law includes an exemption for providers to make if they believe that the client doesn't have the 7 days to wait or are facing such great suffering, which is a huge advantage and similar to what Oregon has done and allows people to not be waiting as long as they do for this law in cases where they don't have the time. And finally, it modernizes prescription delivery. You will hear from our story next about how far people have to drive or how far people have to go to get these medicines. And this legislation would bring it into the modern century where we would be allowed to do electronic prescribing, courier prescriptions, and authorized pickup. So next, I'm going to pass it over to Shay Blaine, who's going to share the story of his wife, Linda. We recorded this video with Shay yesterday because he couldn't make it to the event tonight. And although a few moments of the video quality are a bit fuzzy, you won't want to miss out on this story. because it's a really important insight into how this law works on the ground. So I'll pass it over to him.
Hi, my name is Shay Blaine, and I have been invited by the Death with Dignity organization to speak to some of my experiences with this process. And I want to say in the beginning that I have a lot of experience around hospice as a social worker. I've helped start hospices. I've done a lot of hospice work in various settings. So I say that now because it can feel a little unusual to some people that I'm as relaxed and talking about my experiences as I most often do. We'll see what happens now, but I had the opportunity to help my wife die a little less than a year ago. On March 30th, she had had some open heart surgeries that caused a failure of her heart. What didn't happen, we had hoped for a recovery so that she would have much more vibrancy in her life, but that surgery failed. She ended up having multiple organ failure, and she decided that she wanted to use the option of taking medicine that would end her life under her choice when she wished to. And the way it worked for her is that she started the clock because we knew that it took 2 weeks in order for everything to be in place to formally allow that and for the doctor's approval and the prescriptions to happen. So she started the clock in the in the hospital. And it was really something for me to get a call from a palliative care doctor because I knew what that meant. So then that's the day that I learned that she was not going to be recovering from her surgeries. She was going to be choosing to die. So we brought her home, had hospice involved, Hospice of the Northwest, great folks, helped enormously. In-home hospice is great. Had a hospital bed in front of her altar. She was a Buddhist, chanted every day for many, many years. So her hospital bed was right in front of her altar. She didn't want anyone else present but myself. And I'll say it this way, because it's the truth, and it's the most beautiful way I can say it, that helping her with her death was heartbreakingly beautiful. And my task in my life now is to keep my heart open. So we had lots of support. It took relatively a few minutes. It took about 10 minutes from when she actually drank it. And that's a huge transition, by the way, for everyone who's present, especially loved ones, is to have your loved one talking with you, present. You hand them something to drink. They drink it. And within minutes, they have changed significantly, and then they're gone. That's a huge change to adapt to, and a huge blessing. She was no longer suffering. Her body had multiple organ failure. She gained a lot of water weight. It was very uncomfortable. It was beautiful for her, and she got to decide. So I'm trying to give a representation of what this can be like. With my wife, we were concerned because she might fail so that she couldn't actually swallow it. And there was a backup plan of being able to use a rectal syringe, but she would need to push it herself for that to be able to work and to follow the law. We were wondering whether she could actually swallow that much volume and had to practice it. So she was getting to a place where her organ failure and she had reasonable pain control, so that was great. I just think it's a beautiful option that we need to have it more and more in place, and to take all of the circumstances into account legally and legislatively to make it possible. And it certainly isn't something that's set up for people who are clinically depressed to be able to end their life that way. It's a medical condition. And I just really appreciate everyone who's doing it, and I thank everyone who's involved to help it happen. I hope it becomes easier on a more broad spectrum for everyone. One of the concerns with my wife, and her name is Linda, was that she was ready to die right away. She said, Shay, I want it to happen as soon as it can possibly happen. When the medicine arrived, she said, okay, what's the first step? And there's medications that are taken orally. Usually there's an anti-anxiety medication, which she did not want. She's a very highly sensitive person, and that could have affected her in ways that she didn't want to deal with. And then there's an anti-nausea medication. So that has to be taken an hour before. As soon as it arrived, she said, okay, I want to take the first one. I said, okay. She would have taken it days and days and days earlier if she could have. She was prepared. She was ready. She was concerned she wouldn't be able to. I'd like to add two things. One thing is that I got into a bit of a dilemma. Not everyone may know that only formulating pharmacies can make up the medicine that will help end a person's life. It's not easily available. And it costs $700, and some people can't afford that. So that's a whole other issue. So I live on Orcas Island in the San Juan Islands. One of the formulating pharmacies happened to be relatively close in Anacortes. Another is in Bellingham, another is in Mill Creek. So I got into a place where I wanted to see if the hospital could take the medicine to the ferry landing and to bring it to the ferry landing, and a friend could be at the ferry landing to take it. And I got into a conversation with a pharmacist, pharmacy helper, and I asked if could the hospital deliver that just like they would deliver a patient to the ferry, which they do. Oh, no, we can't do that. And I said, well, could a cab driver pick it up, or what? Oh, no, let me get the pharmacist. So the pharmacist came online, and what she had already told me is, no, it needs to be a family member. And I said, well, I'm her only family member. I'm not going to leave her. What can we do? I'll cut this part of the story short and just say the pharmacist himself agreed to drive to the ferry. I'm so grateful for this. Still, it brings this up. This pharmacist brought it to my friend and handed it to him. The other thing to say is after my wife died, I had permission from our local coroner to transport her body to Anacortes to be cremated myself. So I slept with her body that night. The next day, I had friends come over to help put her body in our car. I took her to Anacortes. I was able to kiss her one more time, kiss her body, and they helped me put her on a gurney, and they wheeled her into the nursing home, to the funeral home. I say this much because not everyone is comfortable with those kinds of things and would never choose it. But I say it because it was beautiful for me and my grieving, and those are possibilities for others.
We want to take a moment to pause here and just extend our deepest gratitude to Shay for sharing his and Linda's story in such a beautiful way as well. And I would also like to invite everybody to take just a deep breath after that and maybe encourage you to engage in a little bit of reflection. It is important to highlight that everything that we're going to be discussing tonight is deeply personal, as Shay's story made evident. And it is also important to highlight that we have a lot of folks experiencing essentially similar situations. Over 800 people reached out to End of Life Washington last year, and many of them face similar barriers. So we would also like everybody to keep that in mind as we move forward to the next portion of our event this evening. So with that, I would love to hand it over to Nancy Zapiro, and I will let her introduce herself, but we're essentially now going to get a little bit more into the nitty-gritty of the bill and hear more about it. So thank you, Nancy, for being here, and take it away.
Thank you very much. Good evening, all. Well, that was an incredibly powerful story, and I think it articulates more eloquently than I ever could that dying well matters, that how we choose to die matters, and the importance of ensuring that we all have meaningful access to a full range of end-of-life choices. And I just also would extend my sympathies and gratitude to Shay for sharing his story. I have been asked to talk a little bit about what to expect in the 2023 legislative session from my perspective as someone who spends their days in and around the state legislature and who has been working with End of Life Washington to try to increase access to medical aid in dying in our state. Here in this Washington, the legislature will begin their work on Monday, January 9th. I think everyone is ready to come to Olympia and to get to work, which I think one could contrast with what's going on in the other Washington, where there seems to be complete chaos. I think the most important thing for me, and I think for many others, is that this legislative session is going to be in person. Legislators, staff, lobbyists, we all left the Olympia Capitol campus on March 6, 2020, and I calculated, and that was 2 years, 10 months, and 3 days ago. And for many of us, we have not been back since. The world has changed dramatically since that time. It does feel like a lifetime ago. I guess the one frame of reference I would offer is I recall in those weeks before the end of session in 2020, several weeks before the conclusion of the session, the legislature decided that they should be investing $1 million in COVID response. And at the time we thought, oh my gosh, that's a lot of money. This must be something. And then right before the conclusion of the session, they upped that to $10 million. And we were all astounded at the amount of money that was being put aside for this thing we were beginning to hear about. And it just highlights to me sort of how long ago that was and what we've all been through since then. So the reason why I talk about it being in person is I think it's going to make just a huge difference in the work that we all do. For the past 2 years, everyone from the governor to 49 senators to 98 House members to staff to advocates, we've all been sitting in our bedrooms or in our basements or in our home offices. And we've all been, just very, very isolated and reaching out across the wires. The work that, trying to pass policy and make good change is hard in the best of circumstances. A lot of the work is about relationships, building relationships, creating relationships. And I'm sure I don't need to tell all of you how challenging that is to do via Zoom. So I think we've all sort of recognized that over the past 2 years. It's a wonderful mechanism, but it certainly has many, many shortcomings. And in addition to that, so much of the work that happens to take a policy idea from an idea to actually have it pass and become law is so much of that work happens in real time, and there are bumps and detours along the way. And when one is working in person, you can very easily grab someone in the hallway, you can talk with them, you can respond to the question, you can get an answer for someone, and you can address the issue and move on and then continue to shepherd the policy forward. When we were operating in a remote environment, you sent an email to someone, you left a voicemail message and hoping that someone would respond back to you. And as a result, things that maybe were small issues tended to remain unresolved. They began to fester, and issues that needed to be addressed, we just weren't able to address them in a timely way. And I think because of that, a lot of really good policy, not just our policy that we're working on, just wasn't able to advance. So really looking forward to being in person, having the opportunity to engage one-on-one with legislators, talk with them, respond to their questions, and if and when and as issues arise, being able to sort of deal with them quickly, with the hope that this bill is going to make it to the finish line this year. I will note, just as an aside, that as far as public hearings and public testimony, there will continue to be an opportunity for people to testify remotely. And I'm sure as the session goes on, once we know of hearing dates, we'll be letting you know of those hearing dates, and would certainly appreciate people, either weighing in, just letting the committee know that they're supportive, or having the opportunity to testify remotely, and we'll provide information about that as the time arises. So the few other things I want to touch base on is sort of a brief review of the advocacy work that we have done the past couple of years that have brought us to this point. And I think one of the main points I'd like to make is that End of Life Washington has just made tremendous strides and really jumped all into the world of advocacy over the past couple of years. And I'm really immensely proud to be a part of those efforts, and just think we have done some tremendous work over the past few years. So taking you way back to 2020 again, we began to work with Representative Skylar Rood, who's a legislator from Walla Walla, a Republican legislator from Walla Walla. And he had a constituent whose spouse was unable to access the medical aid in dying law. And so he was interested in taking a look at what the barriers were to accessing our current medical aid in dying law. And so we, in working with him, thought it made sense to do a study to try to assess what those barriers were. And so we spent the 2020 session working to get funding within the state budget for a study to be completed, did a lot of great work, got a lot of great support. That funding request was included in the budget. It made its way through the budget, and we got all the way to the governor's desk. And COVID was exploding at that point, and the governor vetoed it because it was calling upon the University of Washington to do this study. And there was a recognition that really the University of Washington, their health department, all hands on deck were needing to focus on this evolving pandemic. And so our request for the study, that it was vetoed. So over the interim, then what we did is we met with physicians who participate in Death with Dignity. We talked with families who had attempted to access or had accessed our medical aid in dying law. We continued to work with Representative Rood and others, and we decided to introduce legislation that would really address some of the barriers that we continued to hear about. And those were barriers that Casa mentioned, as far as difficulty in accessing medications, inability to access providers who can or are willing to participate, and the challenges of the waiting period. And so we came up with a bill back in 2021 that addressed those main barriers. We had some good bipartisan support in the House, and the bill was successfully passed through the House. It went to the Senate. We had a hearing in the Senate. It came out of the Senate committee, but that's sort of where it lost its traction, and it faltered at that point. Again, not unheard of. I will say, I often have to remind people that, passing legislation, it's a marathon, not a sprint, that it often takes years and years to pass good legislation, systemic changing policies. And so, we all felt really good about the progress we had made in 2021, and we're determined to come back in 2022. We spent the interim over the summer and fall of 2021 talking with senators, because that's where the bill had faltered the year before. And we realized that a lot of the folks in the Senate didn't know a whole lot about the medical aid in dying law. So we spent a lot of time talking to state senators, educating them, letting them know about the law, responding to their questions, because we thought they really needed, everyone sort of needed to be operating from the same basis or level of information. So that's how we spent our energies in 2021. 2022 came. The bill, again, passed very quickly out of the House, went to the Senate. It was heard in the Senate, and we faltered there again. I think in what we learned in retrospect is there were a lot of people within the Senate who cared about the bill, but legislators have many, many issues that they care about. And what we really needed was someone who felt deeply passionate about the bill and was willing to sort of go to the mat to make sure it didn't fall off the radar. There are hundreds and hundreds of bills. Very few of them make it through the entire process. And so we recognized what we really needed was a champion within the Senate who was going to help us, elevate the importance of this bill throughout the entire process to ensure that we made it across the finish line. So really, pleased to say that we spent a lot of time this summer trying to find that Senate champion, and we found that in Senator Jamie Peterson. He is a state senator from Seattle, the 43rd Legislative District. He is He's also the majority leader of in the Senate. He is an attorney and he is a highly respected member of the Senate. So we are very pleased that he has agreed to champion this bill in the Senate. Representative Rood will also continue to work on the bill in the House. We intend to have a vehicle both in the House and in the Senate. And I can share with you all that as of an hour or two ago, the bill has been dropped and we have a bill number. It's Senate Bill 5179. And I'm also pleased to report that the second sponsor of the bill is a Republican. So at this point, we have a bipartisan bill that will begin the process in the Senate, and just really, really pleased about that. So I guess to conclude, we are hopeful, we are optimistic, we're excited about the opportunities in 2023. Obviously, there are no guarantees. Again, marathon, not a sprint, but we are going to give it our all and do everything we possibly can to get this bill to the governor's desk in 2023. And we hope that you will all join us in that effort, and we will have many ways that you will be able to help us out as the session begins. Thanks so much.
Thank you so much, Nancy. That was wonderful and good to know that we have a name and number for the bill. So next, I am going to hand it over to our executive director, Judy Guinea. She is going to address some of the questions that are popping up in the chat. And also let everybody know how you can get involved and do some closing remarks as well. And after that, just as a reminder, we will have a little bit more time for questions. Okay, Judy, take it away.
Thank you so much. Thanks everyone for being here tonight, and appreciate Nancy and Casa and Shay. So my role tonight is to convey that to protect access to medical aid in dying and to pass this legislation, we need you to be the powerful force that we know that you are. And Casa's right. Most of us trust that if we need it, we can access medical aid in dying. And the truth is, access to medical aid in dying, supported by a clear majority of Washingtonians, is threatened. The evidence for the need to protect access to medical aid in dying is very clear. As Casa mentioned, 1 in 4 end-of-life Washington clients do not make it through the current 15-day waiting period. Half of Washington's health systems opt out of providing medical aid in dying for religious reasons and are not mandated to refer their patients to aid in dying resources like End-of-Life Washington. Some areas of our state are especially impacted. Close to 70% of Washington counties lack both a compounding pharmacy that Shay mentioned that's needed for the medication, as well as participating health systems, 70%. A recent study out of University of Washington showed that only 1 in 10 terminally ill individuals and their caregivers reported no barriers to accessing medical aid in dying. 1 in 10. So even though medical aid in dying has been a legal medical option in Washington for almost 14 years, there are still too few medical providers prepared to support their patients' access to medical aid in dying. You heard the personal side of the limited access to aid in dying from CASA and from Shay. Nancy did a great job of outlining the environment and the plans for this year's legislative session to protect access to medical aid in dying. The preparations are in place. Let's not deceive ourselves. This is not a time to sit on the sidelines with our thoughts and prayers. This is not a time to assume that things will go well without you. If passing this legislation was easy, it would have been done by now. There is a small but very well organized opposition to protecting access to medical aid in dying. We expect extensive and emotional misinformation campaign, and also a powerful lobby that is consistently against individual choice and bodily autonomy. But let's also be clear that everything that End of Life Washington has ever accomplished has been because a group of people has stepped forward and said, let's make this happen. And I think we're here again. There's 3 areas that we can use your help. The first is, let's stay in touch. So with End of Life Washington, with your legislature, and with your networks. So our action alerts will begin next week. So 1, make sure that you are signed up to get our action alerts and be on our email list. When you do that, I think someone's going to drop that in the chat. When you do that, it makes it really easy. We make it easy for you to contact your legislator. You don't even have to figure that out. We do that for you. And we also make it really easy for you to share that with your networks. So through email, we're also on Facebook, make that really easy to share, and also on Twitter. So staying in touch and really understanding that you are as important as anything else that we've done in passing this bill. We need to be loud and proud and really conveying to our legislators what our expectations are. Because if we don't, someone else is going to fill that void for us. The second way that you can help us is to help fund our advocacy efforts. End of Life Washington is funded by individuals. Our services are always free. We do not receive any government funding whatsoever. And we do this with your support. The third area is, if you are a loved one of someone who struggled to access medical aid in dying and want to share your story or to testify in Olympia, let us know. So whether that's in person or remotely, let us know, particularly if you're living in a rural area. And if some of the barriers that Casa talked about, or some of the things that I talked about, or Nancy talked about, if those really touched you in a personal way, let us know. And we'll either help to share your story, testify in Olympia, or we'll help share your story in other ways. We have a strong bill. We have strong support in Olympia. I hope that you join us as an active and persistent advocate to protect access to medical aid in dying. Thank you so very much. Daniela?
Thank you so much, Judy. Yes, to summarize, we have been putting those links in the chat, everything that Judy just mentioned in terms of how to get involved. And again, just a reminder that those will also be included in the follow-up email that we will be sending out tomorrow. So if for some reason you can't find them right now, or you can click on them, don't worry, you'll get them tomorrow. So with that, we would like to open it up for questions. As far as I can tell, Rebecca and Raven have done an excellent job at answering all the questions that have been dropped in the chat so far. But we encourage you to put more questions in the chat if you have them. Also, if you would prefer to unmute yourself and ask a question, we are open to that. It just makes it a little bit harder to track because there are 70 of us right now in this Zoom room. So it might take us a moment to find you. And we do have a question by Jeff in the chat. Will you be providing a recommended text that we can follow when we reach out to our district legislators?
I can answer that. Yeah, I can answer that. Yes, Jeff, what we'll do is we'll have copy of potential text that you can share. You can just pull that out and pull it right into a they're action alerts. They're super easy, and they identify your legislator. It makes it all super easy for you.
Thank you. And Catherine asks, are possible grant sources of funding being pursued? And Judy, I believe.
Definitely. We are definitely pursuing grants with foundations, particularly on this issue of access, access to medical care. So we're all aware that access to medical care is a significant issue outside of end-of-life choices. And we're really working with a consultant group and writing grants and anticipate funding. But oftentimes with grant foundations, it can take a couple years to really get that traction and get that going. But we are working on that significantly this year. We really want to diversify our funding for medical aid dying.
And then Jeff asks, what organization is behind HB 1035?
There are no organizations behind it. It was offered by Representative Amy Whalen. I think in response to some of the frustrations in accessing care, but that is not being worked on by any organizations. I also, my brief glance of it, and also in a conversation that I had with Representative Whalen, there may be some constitutional concerns with it. So that's the extent of what I know about that, Bill.
Thank you. And I believe Rebecca just answered the questions that we have in the chat about dementia and access. And then I see one from Rory. Will there be talking points developed and distributed? I'm particularly interested in differentiating Washington's death with dignity law with the current May debacle in Canada.
Yeah,
Rory,
I can answer that too.
yeah, okay, go ahead.
So yes, we'll definitely have talking points. We have Rory, and I guess to everyone, we have a really strong, very active advocacy group. So End of Life Washington is partnering with Compassion and Choices, and together we're developing talking points, Q&As as it relates to disability rights and the law in general. And we will be sharing that with legislators. Also sharing that out with folks on our email list so that you can share those out with others as talking points when you're talking with people, and there's a lot of that information, misinformation out there, that will be helpful for you as well. And so our email, Facebook, our emails, I think those are going to get shared out either tonight or tomorrow. We are here and have plenty of information that's like easy to understand and easy to share.
Judy, yes, and we share them in the chat, but they will also be included in the follow-up email.
Great.
And then we have Jeff asking, is there hope to get Whelan's objectives merged into our bill so 1035 can be dropped so it doesn't compete for oxygen with ours? Nancy, I don't know if you want to take that one.
Yeah, we definitely will be having conversations with Representative Whalen. Yes, so we definitely will be doing that, because you're right, there is limited oxygen for controversial topics. So we will certainly be working with.
Thank you, Nancy. And Kat asks, what would you like us to do next? How would you like us to engage to help you get SB 5179 passed?
We'll be sending out our first action alert next week that will contain some of these like updates with the bill and sponsors and a sense of timeline and how to share that out with your networks. So just make sure that you're following us on Facebook, you've signed up for our email list, and we'll start sending that out next week.
Yes, and now let's just put the link to sign up for action alerts in the chat again. Lisa, we see your question. My recommendation would be that you call our office, and we can definitely follow up with you to give you that number after the event. But yeah, that will be a, a detailed conversation with you. So I would just encourage that. We are right on time. So I do want to be respectful of that and thank everybody so much for joining us tonight. We hope that you're as excited as we are about this bill and about supporting it. Again, one last reminder that we will be following up with all of you via email to share all these links, answer any questions that weren't answered, and share the recording for tonight's event as well. Thank you so much to all of our speakers as well. We really appreciate you, and I hope you all have a good night.